Hi guys, welcome to the healthcare channel. Today's video we'll talk about diagnosis, treatment, and medications. For schizophrenia, how to diagnosis. Diagnosis of schizophrenia involves ruling out other psychological state disorders and determining that symptoms aren't thanks to drug abuse, medication, or a medical condition. Determining a diagnosis of schizophrenia may include 1. Physical exam. This might be done to assist rule out other problems that would be causing symptoms and to see for any related complications. 2. Tests and screenings. These may include tests that help rule out conditions with similar symptoms and screening for alcohol and medicines. The doctor can also request imaging studies, like an MRI or CT scan. 3. Psychiatric evaluation. A doctor or psychological state professional checks mental status by observing appearance and demeanor and asking about thoughts, moods, delusions, hallucinations, substance use, and potential for violence or suicide. This also includes a discussion of family and private history. 4. Diagnostic criteria for schizophrenia. A doctor or psychological state professional may use the standards within the Diagnostic and Statistical Manual of Mental Disorders (DSM-5), published by the American Psychiatric Association. What is the treatment? Schizophrenia requires lifelong treatment, even when symptoms have subsided. Treatment with medications and psychosocial therapy can help manage the condition. In some cases, hospitalization could also be needed. A psychiatrist experienced in treating schizophrenia usually guides treatment. The treatment team also may include a psychologist, caseworker, psychiatric nurse, and possibly a case manager to coordinate care. The full team approach could also be available in clinics expertly in schizophrenia treatment. What are the medications? Medications are the cornerstone of schizophrenia treatment, and antipsychotic medications are the four most commonly prescribed drugs. They're thought to regulate symptoms by affecting the brain neurotransmitter dopamine. The goal of treatment with antipsychotic medications is to effectively manage signs and symptoms at rock bottom possible dose. The psychiatrist may try different drugs, different doses, or combinations over time to realize the specified result. Other medications also may help, like antidepressants or anti-anxiety drugs. It can take several weeks to note an improvement in symptoms. Because medications for schizophrenia can cause serious side effects, people with schizophrenia could also be reluctant to require them. Willingness to cooperate with treatment may affect drug choice. For instance, someone who is immune to taking medication consistently may have to tend injections rather than taking a pill. Ask your doctor about the advantages and side effects of any medication that's prescribed. Second-generation antipsychotics. These newer, second-generation medications are generally preferred because they pose a lower risk of great side effects than do first-generation antipsychotics. Second-generation antipsychotics include 1. Aripiprazole, Abilify. 2. Asenapine, Safras. 3. Brexpiprazole, Rexulti. 4. Cariprazine, Vrila. 5. Clozapine, Clozaril, Versacloz. 6. Iloperidone, Fanapt. 7. Lurasidone, Latuda. 8. Olanzapine, Zyprexa. 9. Haloperidol, Invega. 10. Quetiapine, Seroquel. 11. Risperidone, Risperdal. 12. Ziprasidone, Geodan. First-generation antipsychotics. These first-generation antipsychotics have frequent and potentially significant neurological side effects, including the likelihood of developing a movement disorder, tardive dyskinesia, which will or might not be reversible. First-generation antipsychotics include 1. Chlorpromazine. 2. Fluphenazine. 3. Haloperidol. 4. Perphenazine. These antipsychotics are often cheaper than second-generation antipsychotics, especially the generic versions, which may be a crucial consideration when long-term treatment is important. Long-acting injectable antipsychotics. Some antipsychotics could also be given as an intramuscular or injection. They're usually given every 2 to 4 weeks, counting on the medication. Ask your doctor about more information on injectable medications. This might be an option if someone features a preference for fewer pills and should help with adherence. Common medications that are available as an injection include 1. Aripiprazole, Abilify Maintena, Aristada. 2. Fluphenazine decanoate. 3. Haloperidol decanoate. 4. Paliperidone, Invega Sustena, Invega Trina. 5. Risperidone, Risperdal Consta, Persis. Psychosocial interventions. Once psychosis recedes, additionally to continuing on medication, psychological and psychosocial interventions are important. These may include 1. Individual therapy. Psychotherapy may help to normalize thought patterns. Also, learning to deal with stress and identify early warning signs of relapse can help people with schizophrenia manage their illness. 2. Social skills training. This focuses on improving communication and social interactions, and improving the power to participate in daily activities. 3. Family therapy. This provides support and education to families handling schizophrenia. 4. Rehabilitation and supported employment. This focuses on helping people with schizophrenia steel oneself against, find, and keep jobs. Most individuals with schizophrenia require some sort of daily living support. Many communities have programs to assist people with schizophrenia with jobs, housing, self-help groups, and crisis situations. A case manager or someone on the treatment team can help find resources. With appropriate treatment, most people with schizophrenia can manage their illnesses. Hospitalization. During crisis periods or times of severe symptoms, hospitalization could also be necessary to make sure safety, proper nutrition, adequate sleep, and basic hygiene. Electroconvulsive therapy. For adults with schizophrenia who don't answer drug therapy, electroshock (ECT) could also be considered. ECT could also be helpful for somebody who also has depression. Coping and support. Coping with a mental disturbance as serious as schizophrenia is often challenging, both for the person with the condition and for friends and family. Here are some ways to cope. 1. Study schizophrenia. Education about the disorder can help the person with schizophrenia understand the importance of sticking to the treatment plan. Education can help friends and family understand the disorder and be more compassionate with the one that has it. 2. Stay focused on goals. Managing schizophrenia is an ongoing process. Keeping treatment goals in mind can help the person with schizophrenia stay motivated. Help your beloved remember to require responsibility for managing the disorder and dealing toward goals. 3. Avoid alcohol and drug use. Using alcohol, nicotine, or recreational drugs can make it difficult to treat schizophrenia. If your beloved is addicted, quitting is often a true challenge. Get advice from the healthcare team on how best to approach this issue. 4. Ask about social services assistance. These services could also be ready to assist with affordable housing, transportation, and other daily activities. 5. Learn relaxation and stress management. The person with schizophrenia and loved ones may enjoy stress reduction techniques like meditation, yoga, or Tai Chi. 6. Join a support group. Support groups for people with schizophrenia can help them reach others facing similar challenges. Support groups can also help family and friends cope. Preparing for your appointment. If you're seeking help for somebody with schizophrenia, you'll start by seeing his or her general practitioner or healthcare professional. However, in some cases, once you call to line up a meeting, you'll be referred immediately to a psychiatrist. What you'll do. To prepare for the appointment, make an inventory of 1. Any symptoms your beloved is experiencing, including any which will seem unrelated to the rationale for the appointment. 2. Key personal information, including any major stresses or recent life changes. 3. Medications, vitamins, herbs, and other supplements that he or she is taking, including the dosages. 4. Inquiries to ask the doctor. Go with your beloved to the appointment. Getting the knowledge firsthand will assist you to know what you're facing and what you would like to try to for your beloved. For schizophrenia, some basic inquiries to ask the doctor include 1. What's likely causing the symptoms or condition? 2. What are other possible causes of the symptoms or conditions? 3. What sorts of tests are needed? 4. Is that this condition likely temporary or lifelong? 5. What is the best treatment? 6. What are the alternatives to the first approach you're suggesting? 7. How am I able to be most helpful and supportive? 8. Does one have any brochures or other printed material that I can have? 9. What websites does one recommend? Don't hesitate to ask the other questions during your appointment. What to expect from your doctor. The doctor is probably going to ask you a variety of questions. Anticipating a number of these questions can help make the discussion productive. Questions may include 1. What are your loved one's symptoms, and when did you initially notice them? 2. Has anyone else in your family been diagnosed with schizophrenia? 3. Have symptoms been continuous or occasional? 4. Has your beloved talked about suicide? 5. How well does your beloved function in lifestyle? Is he or she eating regularly, getting to work or school, bathing regularly? 6. Has your beloved been diagnosed with the other medical conditions? 7. What medications is your beloved currently taking? The doctor or psychological state professional will ask additional questions, supported responses, symptoms, and needs. Please don't forget to subscribe to our channel for more recommendations on health, relationship, lifestyle and other helpful information to form life easier.